Hello everyone and welcome as new members of the BOH family. As you remember from Station 7 at your multi-minute interviews, I am Roland, a recent graduate from a BOH degree, former class representative and SUDA 2014 BOH Vice President, which I'll tell you a little bit more about shortly. I remember being in your seat 3 years ago, full of anticipation and curiosity about what lies ahead, and I hope I could satisfy your curiosity today with enough information and tips and answer some of the questions that may be floating around in your head while taking you along on a journey of the BOH program from my student perspective. Now, all the information I am giving you is based on my experience when I was in your shoes, and some bits may change and develop in your time, so it's best to always confirm with your tutors. The BOH program was first introduced in the Faculty of Dentistry in 2005 and comprises of a dual qualification of dental hygiene and dental therapy, as well as an oral health promotion and education program, all combined to provide you with the title of an oral health therapist. This is a 3-year full-time course with quite demanding theoretical and practical components, and almost feels like high school over again, in that you will be at uni from Monday to Friday, starting off with 4 days of theory, so lectures and tutorials, and 1 day of prac in the simulation clinic at Westmead, where you start to develop your fine motor skills and manual dexterity and learn how to handle your dental instruments and materials appropriately. This is also where you progressively begin to practice all your dental treatment procedures on mannequins and plastic teeth. Most of the equipment are provided for you in the sim clinic, but you are also required to buy some stuff. So I hope you've saved up over the holidays. This stuff includes your clinical attire like scrubs, lab coat, safety glasses, and protective leather shoes, in addition to dental equipment like a typodon, which is a plastic mouth where you screw on plastic teeth, a face mask for the mannequin, an instrument kit, plastic teeth, and other equipment which you'll get a lot more information about from your tutors. So this was a little overview about your practical component in Sim Clinic. And in second semester, you actually start practicing hygiene in the Westmead Hospital on each other. And this is where the real fun begins, to set you up for treating your first patient in second year. So my tip here is, be gentle. By the way, attendance to all your clinical sessions and tutorials is 100% compulsory, and the remaining lectures require 90% attendance. So you can now sense that this will be your second home. And yes, it is quite demanding, but on the plus side, this sets you up to the professional life. So well that you will almost have no troubles picking up a full-time job. Now, in regards to the theoretical component, your lectures will cover various topics that branch under 4 main units of study. These subjects will be on life sciences, anatomy, communications and behavioral sciences, hygiene, therapy, radiography, oral health and society, etc., etc. This may sound like a lot of big words, but you will get a much clearer understanding as you move along. And I think it's very important for you to grasp that Year 1 is heavily dense with new information on many different topics, and my tip is for you to keep a diary and a to-do list to stay very well organized. Try and write all your study notes on the same day you have the lecture. Be involved in study groups and discuss the topics you've learned with one another, because this is a very effective way to retain information. In second year, you start seeing your first hygiene patient in semester 1 and your first therapy patient in semester 2. Sounds like a big challenge and quite a fast transition into the clinic. But my tip is to never let your patient or their parent know that they are your first patient. In second year, you start to have less but more detailed theory and more time in the clinic. And this is where you start to put all the knowledge you've gained in oral health promotion to practice, and where you go out to a preschool in groups and implement an educational program to teach preschoolers, teachers and their parents all about oral health. Moving on to year 3, this is the time to really sharpen and perfect your skills. You'll be in the clinic for 4 days, with 2 days of hygiene and 2 therapy, and in 4 different clinics across Sydney, as well as some additional orthodontics, special care and observation sessions that you'll be rostered for. A very big component in your last year of study is selecting 2 of your patients, 1 hygiene and 1 therapy, and providing them a complete course of care throughout the whole year based on and supported by your research scientific evidence. By the end of every semester, you are required to submit a portfolio and present a PowerPoint presentation to showcase your knowledge and skills that you have accumulated over the 3 years. This task can be very stressful if you don't find a suitable patient for your case early on in the year, but your clinical educators are extremely helpful in making sure that you are keeping up with it all. Moreover, the Oral Health in Society subject also raises the bar to 2 bigger and better projects where you get to go in groups to a rural community in New South Wales or even Vanuatu for 10 days to implement an oral health promotion project for which you'll need to present an abstract poster on Faculty Research Day in 2nd semester. And in 2nd semester, you also implement another oral health promotion project in an aged care facility. So in summation, you now have a good idea about what to expect over the next 3 years in terms of your curriculum-based and practical learning. But there's a lot more fun to it than that. In terms of leadership, you will soon participate in an election process to vote for and elect 2 candidates of your own, who will run for and occupy the role of class representatives. Their roles will also include sports, social and e-learning representing. Essentially, they will be the communication bridge between your cohort and the administration, other cohorts and external parties. They will be focused on voicing your opinions, resolving online issues on Blackboard, organising social and sports events, as well as being members of the Sydney University Dental Association, or SUDA for short, where they will attend monthly meetings and discuss all the aforementioned tasks over free dinner. On a more cheerful note, the hard work is well balanced with a series of social and sporting events, well planned to relieve your stress when you need it the most. And I encourage you all to participate because not only is it a great fun environment, but also an excellent way to network with peers and colleagues. Some of these events to look forward to every year are the themed dental cruise, the dental ball, social drinks, barbecue lunches, road trips, inter-faculty sporting events, and the Roland Bryan Cup, where we go head-to-head with Charles Sturt University to win 3 out of 5 sports, and many more events. But what happens next? You will be registered with the Dental Board of Australia as an oral health therapist, and if you wish to get into the workforce, then you can occupy a job in private dental clinics or the public sector, or have the potential to pursue postgraduate studies in the dental faculty to earn your master's, PhD, or even dentistry. For me, it's been a great journey. I've been lucky enough to be selected in the Oral Health Therapy Graduate Year Program, OHC-GYP, run by ATEC, which offers 50 positions nationwide, and I'm currently practicing in southern New South Wales, about 15 minutes away from Canberra, under the mentorship of an excellent senior dental therapist. I have actually just come back from a 3-day workshop about this program hosted in Adelaide. The great advantage of this program is that not only do you get a lot of clinical experience, 4 days a week in the clinics, but there's also 1 curriculum day where you work on 20 different cases and a major project throughout the year. On a final note, I'd like to express my gratitude for the opportunity to share my experiences with you. And I hope that you all enjoy this course and make the most of it because it is simply life-changing. I wish you all the very best of luck over the next 3 years. I better get back to work now, but I'd like to leave you with this quote from my favourite man in history, Nelson Mandela. And I quote, "It always seems impossible until it's done."